Here. Alrighty. Thank you everybody so much for joining us. We really appreciate all your patience. We have Congressman Costa here, and we're going to go ahead and segue over to him for some opening remarks. We ask all the members of the press to please keep we ask that you keep your mic muted and that we reserve any background noise up until the end for the questions and answers. Without further ado, Congressman Costa, the floor is yours.
All right. Thank you. Uh, the topic of this afternoon's press availability is a very important subject, and that is healthcare in America. Not only in the San Joaquin Valley, but in California and throughout our country, we know that having the men and women that provide that healthcare for Americans is absolutely essential to have good healthcare. My mother once told me as a young boy that if you don't have health, you don't have anything. Well, without the properly trained men and women in our healthcare facilities, not only in our valley, but throughout the country, it is going to be a real challenge. And that's why this legislation is so important. We can't ignore, nor should we, the shortages of physicians, and I would also add of nurses and a whole host of medical tech people. The bottom line is we simply don't have enough doctors for our growing population. And the problem, I think, was only um, better understood during the pandemic. The Association of American Medical Colleges, AAMC, projects that the shortage of doctors in this country would be in excess of 125,000 by 2034. The San Joaquin Valley that I represent and Congressman Adam Gray represents and our colleagues has among the lowest supply of doctors in California. The ratio is 47 doctors per 100,000 residents. This shortage is combined with language barriers, cultural barriers, and distances that are exacerbating the care in this issue. And that would really go for rural parts of our country where, regardless where folks live, if you live in rural areas, it's just more difficult to have access to good quality health care. That's why I have introduced this legislation along with my colleagues, Congressman Adam Gray and Senators Tim Kaine and Senator Alex Padilla. Uh, Expanding Medical Education is the name of the legislation. Expanding Medical Education Act. This bill would be, I think, transformative because it would invest expanded resources to minority serving institutions and colleges located in rural and underserved areas to establish um, schools of medicine and osteopathic medicine, and would also look to try to augment those schools in those underserved areas. This would open the door for eligibility for historic Black colleges and universities, HBCUSs, and Hispanic serving institutions like HSIS, as well as minority serving institutions like the University of California, San Francisco, Fresno, UC Merced, that has had a long term residency program in the Valley. And this would attempt to expand that effort to a full fledged medical school, which I think is absolutely necessary. The UCSF Fresno, University of California, San Francisco, one of the top medical schools not only in the country but throughout the world, and their partnership with Fresno and the University of California in Merced are already partnering, as I noted, with local hospitals like community medical centers to expand training opportunities. But frankly, there's more work to be done, and this bill will help us get there. Nearly 25 years ago, I secured funding to the University of California, San Francisco, Fresno downtown medical facility, which is actually the second largest hospital now in California. A lot of people aren't aware of that fact. It's one of only 5 trauma and burn center units in the state, and sadly has the highest utilization of the emergency room services, which points out to the need for more physicians. So that is the purpose of the legislation. We've got a good team here with our colleagues in the Senate and with my colleague Adam Gray. And I'll the turn it over to him at this point in time to make his comments, and then we'll have our remaining speakers. My colleague and good friend, Representative Adam Gray.
Well, thank you, Congressman Costa, for your leadership with the Expanding Medical Education Act. Certainly happy to be partnering with you and the senator to improve access to healthcare in rural communities. This has been a passion of mine throughout my service, not just in Congress here, but in the state legislature, where we worked to get hundreds of millions of dollars in funding to expand the University of California Merced campus, to ultimately secure the funding to put the first medical education building up on campus, and of course the partnership with UC San Francisco or with UCSF Fresno and the campus there that you've championed, Congressman Costa, for many, many years, and is an important part of creating the workforce of the future for the Valley, but more importantly, solving this access to care issue that plagues Valley communities. As was said, we have hardly the number of physicians to patient ratios in the Valley. We lack nursing infrastructure. We've had hospitals close in some of our communities. Happy to recently see the reopening of Madera Community Hospital, but certainly that story underscores the importance of these kinds of investments to make sure that we can have equitable healthcare in rural communities, which in turn provides for economic development and gives people the community they deserve to live in. So extraordinarily happy to be here, to be a partner in introducing this legislation, and most importantly, in improving access to healthcare in our rural communities in the San Joaquin Valley. Thank you so much, and look forward to answering some questions.
Great.
Hi, my name is Dr. Margot Venner, and I'm the Director of Medical Education at UC Merced, and I'm also a family doctor. And I wanted to just talk for a minute about the real human impact of what some of these statistics mean, because UC Merced just opened as a regional medical campus of UCSF with a BS to MD program. And so we've had an absolute outpouring of students who are interested in taking these spots and being part of the BS to MD program. It takes an extraordinary amount of dedication and hard work to sign up for such a long career path. And when you ask students and their families, why are you doing this? Like, why would you sign up for such a long and difficult training path? They all have the same story, which is, I saw someone in my family not get the health care that they need, or get the health care delayed, or have other problems accessing care, and I want to make a difference for my community. And the impact of that is absolutely huge. All the students that we are enrolling are from the Valley and for the Valley, because they want to really make a difference in promoting health in their communities. One of the things that we often talk about with their students is that you have to, quote, see it to be it. So for our students, it's hard for any student to be a health professional, but without role models, it's even more difficult. So the opportunity to have a BS to MD program and create more health professionals in the Valley means that we're having a ripple effect already with even just, these are baccalaureate students, we haven't even made it to med school yet, but with the expanding pool of students, it seems possible. When you see someone from your high school or someone from your community who's already on this track, the enrollment and the interest has just skyrocketed in the UC Merced program, because students from the Valley realize, if somebody else could do it, maybe I could. And so this is really making a difference in inspiring interest in medical careers, for sure, to become a physician, but also in all healthcare careers. We've had an increase in interest in pharmacy. We're looking at starting a pharmacy track. And as anyone knows who has been to the doctor or practiced medicine, a single physician alone can't do it. We need healthcare teams. So we need nurses and occupational therapists and dentists and physical therapists. And we're seeing interest in all those areas because, again, see it to be it. We're making a difference in the community. And to our students and to our community, this is really about seeing that our state and our country is invested in their health, in their well-being, and really in their in their advancement as the physicians and healthcare professionals that will make a difference for tomorrow. And what we're giving the message is that all of this is possible. They're going to be the excellent physicians that our community needs in the Valley, and we're hoping that that will just create more opportunities for others. Thank you.
Thanks, Margot. My name is Dr. Kenny Bond. It's nice to meet everybody here. I am the Assistant Dean of Undergraduate Medical Education here at UCSF Fresno and an emergency medicine physician as well at Community Health Systems and CRMC at that safety net hospital we referred to. I just want to take a moment to first thank Congressman Costa and Gray for their ongoing and continued leadership in this field, not just with this bill, but over the years, both at the federal and at the state level for focusing on the need for medical education, growing doctors in the region. I'd like to highlight that regional campuses such as UC Merced and UCSF Fresno not only grow doctors, but they take those doctors, physicians, and medical students from their communities in the region and train them in those regions to go back to be physicians in those areas. And an institution like UCSF and UCSF Fresno is not just a school with medical students, but it is a comprehensive network with medical students, residents, and fellows training at all different levels, from primary care and basic sciences all the way to our interventional cardiologists and surgeons, bringing in the need of doctors across the spectrum, but also a top 5 research institution bringing in cutting edge medical research and innovation so that we make sure that we're not only accessing doctors, but bringing top-notch care and medical treatments to the region so that you don't have to go to San Francisco or Los Angeles or to other parts or other states in order to reach that care. I also want to mention that I am the incoming chair of the AAMC, Group 1 Regional Medical Campuses. As the chair of the AAMC, I will say that the AAMC does support and sponsor this legislation, both at the Senate and the House, and we are proud that Congressman Costa and Gray are taking leadership in trying to push through increased educational opportunities. So I want to lend that support in my other hat as well. And with that, I'll hand it to Dr. Utecht with Community Health Systems.
Thanks, Kenny. My name is Tom Utecht. I'm the System Chief Medical Officer at Community Health System. Just a little bit about who we are. We are the Central Valley's largest safety net hospital system. We have 4 hospitals in the greater Fresno area and serve over 57% of inpatient need Fresno County itself. And that's a very rural population. Our downtown hospital, Community Regional, has 685 beds and is the primary UCSF Fresno teaching hospital and the only level 1 trauma and comprehensive burn center. Also note that 5,600 patients were transferred into CRMC over the last year for that higher level of care throughout the Valley. A large number of our patients at CRMC come through the Medi-Cal program. In fact, 55% of our total patient volume is Medi-Cal, which is the 3rd highest in the nation for Medicaid population. So a significant underserved population that we take care of and are honored to do so. We have a long history of involvement with medical education, having been in partnership with UCSF and the Fresno Medical Education Program for over 30 years. And we also have supported the UC Merced Medical Training Program and the PRIME program as well, and are happy to do that. In fiscal year 24, we invested $37 million in medical education. We are partners of the program I mentioned with 300 residents and fellows that train annually and graduate 100 a year. Some of those graduates are here with us. Myself and Dr. Bond both graduated from the program to practice emergency medicine in our system. I do want to highlight what Dr. Costa mentioned earlier, which is how underserved the Valley is. We have 47 primary care physicians per 100,000 folks here, which is a little over half of what is necessary to take care of a population. We have the lowest physician per capita rate in all of California in the San Joaquin Valley. So it is a great thing to have this Expanding Medical Education Act to be introduced, and we are fully in support. Happy to answer questions as well.
Thank you, Dr. Utecht. Congressman Costa, I would like to yield to you for any closing remarks.
Well, I think at this point, we've explained that the need for the legislation is significant, not only in the San Joaquin Valley, but throughout the country. And we believe that this legislation is passed and signed into law, that Health Resources and Services Administration would be able to be in a place to provide institutions that would qualify under this legislation for grants to either establish medical schools, as we're trying to do in the San Joaquin Valley, or to expand existing schools where they would be qualified for. So with that, let's have an opportunity to have the press ask questions of my colleague Adam Gray, myself, and the other three very abled friends of ours who are indicated from their own perspective the need for this important legislation.
Absolutely. Thank you, members of the press, for submitting and adding yourselves to the queue. I will go ahead and turn it over to our members of the press. We ask you to please say your name, your affiliation, and who you're directing your question to. Once again, if you could please say your name, your affiliation, and who you're directing your question to. First on the queue, we have Thomas Sheehan with the Central Valley Journalism Collaborative. Tom, the floor is yours.
Thank you very much. For the Congress members, I'd like to get a sense of what is the ask from this legislation? How much money is being sought in the House version and how much is being sought in the Senate version? And what specifically do you expect this money to be able to do if this does get signed into law?
Well, good question, as usual, Tim. The efforts that we're engaged in at this point is, I think, has to be taken into account with the changes that this new administration is making with Health and Human Services. There is a need that we are trying to determine based upon the geographical areas that would be covered if this legislation were to become law. We're asking Congressional Research Services to give an estimate on what that need is based upon existing colleges that have physician programs, medical schools, in other words, and those that are attempting to create new ones, such as what we are trying to do in the San Joaquin Valley. We don't have an actual number that I could give you, but clearly for the needs that we're talking about in the training and the cost factors, we have a pretty good idea how that translates. And my other three friends who are on here would give you a better idea from their own experiences of what they estimated cost to train a medical student today to become a full-fledged physician. But it's certainly not inexpensive. And so we're trying to figure out what those numbers are to get a kind of a significant impact for the new medical schools that need to be created and the expansion of those existing schools that are serving underserved areas. I don't know if the other three would like to opine, or whether Adam, what do you estimate a cost of training a student at UC Merced that under the current situation, and maybe our doctors here might relate to their own personal experiences?
Well, let's say I'll start off that it's interesting when you ask for a number like how much does it cost to take a med student, looking at a tuition or a cost standpoint. It's actually a lot more complicated than that, because just some background, a medical student actually can't practice medicine. They actually have to go through at least 4 years of medical school, get their doctorate degree, and then train in residency, whether as emergency medicine, a family medicine, psychiatrist, or a surgeon. So the cost of actually producing a doctor, and then if they want to do fellowship after that, become a cardiologist after internal medicine or something afterwards. So what you really should look at is the cost of actually having a physician practicing, and that total cost of how we do that. And in areas of critical shortages like the Valley, that includes the cost of not just training people into getting their doctorate degree, but it's actually part of an infrastructure system of working in health systems and working with residents and fellows and attendings and working through that spectrum in order so they graduate through. And it's very much an apprenticeship system. It's not a sit in just a large classroom, study physiology, and go practice medicine. We have to learn from the specialists in order to not just deliver care, but deliver top-notch quality care in the specialties we need. So I think it's, and I appreciate all the question because it's a great question, but I don't want to oversimplify things of saying like, oh, this is how it costs to create a doctor to put him in, because it's actually a multi-step and it's embedded within the systems. Henceforth, that's why we have undergraduate institutions like Merced represented here, as well as health systems, because you critically can't do it without everyone playing along and to make that happen.
And Tim, that's why I'm glad that I had someone who's got a lot more knowledge and experience than I do in terms of the challenges that we face in terms of trying to pass this legislation and ultimately to put a price tag on it, because clearly we're going to have to start in a way that allows us to get our feet on the ground, but to have something that then over time can be expanded based upon need. And obviously, this is not a partisan issue, and we're trying to make sure that people understand that this is about our healthcare today and the future of our healthcare, as we all, I think, are very concerned about.
Great.
Thank you very much.
Our next question, Congressman, comes from Vince Ibarra with KFSN ABC 30 in Fresno. Vince, floor is yours.
Good afternoon, everyone. I was just hoping to talk to one of the doctors if they could answer just how dangerous this shortage for our healthcare system is. I mean, you guys tap on the, over 125,000 doctors. There would be a shortage of that amount by 2034. But just how does this impact the everyday hospital, the everyday patient? If someone could possibly elaborate. I know it's hard to obviously foresee in the future, but if someone could give any insight to how that would look if in fact we do come close to the shortage.
And I would also add recruiting physicians and nurses for our clinics as well as our hospitals.
Well, I can certainly start. As I mentioned, we are we are above capacity in our hospitals. And a lot of that has to do with the fact that we can't get patients in to be cared for by primary care docs to keep them out of the hospital. And that's a reality now. So projecting to the future is it's only going to get worse. And any busy emergency department in California, you'll see the same thing. They're all having trouble, but particularly sensitive to the San Joaquin Valley, where we're the most underserved. So I don't know. And beyond that, our health outcomes in the Central Valley are lower than most places in the state. If you look at chronic diseases, mental health, respiratory conditions, infant mortality, et cetera. And all of that is also worsened by the fact that people can't see a doctor or a doctor that looks like them. So this type of legislation will be huge in helping that. Welcome Kenny or Margot's thoughts as well.
That's wonderfully said, Tom. I would just add that there's healthcare costs regardless how we work it. If we don't invest in having an adequate supply of physicians, there's a cost on the human that can't access care and presents with very late presenting diseases that's often at that point not treatable or with significantly worse morbidity and mortality outcomes. And that cost is bore by health systems, taxpayers, one way or the other. So education is incredibly important. It's an investment, but the way I look at it is it's a cost that you have to bear, because otherwise you bear a much larger cost down the road.
Great. Our next question comes from Joshua Yeager with KVPR Valley Public Radio. Joshua, the floor is yours.
Hey, thanks so much. Two questions, if that's okay. The first one is, how would proposed Medicaid cuts impact, healthcare services in the Valley specifically? And this is for healthcare professionals.
Well, that's a good question, and I think my colleague Representative Gray would also like to opine on that. We've estimated that the proposed cuts that are being considered, if fully implemented, could impact over 1.8 million residents in the San Joaquin Valley. when you look at my congressional district and Adams and David Valadale's and Vince Fong's and McClintock's, it's estimated that there are over 1.8 million people, young and old alike, on Medicare and Medicaid that cuts would be required that would be, I think, devastating and create havoc. So I'm very concerned about that. What ultimately happens here with these proposed budget reconciliation is yet not clear. And that's why many of us are very adamant in our opposition to making any cuts in the Medicaid or Medicare program. There are other ways that we can find cost efficiencies, and we should. Clearly, we have a very challenging healthcare system in this country where, we like to believe the best healthcare anywhere in the world, but we're paying for it in some of the most expensive ways. And to add other, I think, critical need to this legislation is we have, I'm told by my physician friends here and others, an aging physician population, and many of them with the complication of the current reimbursement systems that are insufficient in so many different ways, add to the strain on the existing system that we're dealing with. And therefore, that's part of a separate area that needs to be addressed and worked on. However, clearly, a shortage of physicians is going to play a very dramatic role if we don't address this need at the same time.
Yeah, I would just add to that any cuts, frankly, to Medicaid and California's healthcare system in the Valley, where over 50% of almost every community we represent, as high as almost 2/3 in some parts of the San Joaquin Valley of residents are served by the program, is moving backwards. And what we're talking about today and the purpose behind the expanded Medical Education Act is to actually increase funding, because we have an inadequate healthcare infrastructure as is. And at current funding levels, we've seen hospitals like the Hospital Madera that were forced to close. And it's an unsustainable business model for anybody to have nearly two-thirds of your residents on a program that's being drastically cut at the federal level. So, somebody asked how much is in this bill. The question ought to be larger than that, in that, we need $10 to $15 million a year to run or expand, rather, the current program at UC Merced from 12 students to 50 students. We need additional funds to both expand GME slots, but we also need to increase the cohort sizes, which will be costly as well. And on top of that, we're going to need another $10 to $15 million a year going forward after that to fully implement the vision of an independent medical school in the Valley. So there are lots of dollars needed. There's an inadequate healthcare infrastructure, a lack of physicians, an aging workforce, an underserved community from Stockton all the way down to Bakersfield and the entirety of Congressman Costa's district combined. And so it should be entirely unacceptable. In fact, I offered an amendment, to my Republican colleagues and the body to try protect Medicaid funding, because it's so critical. So it should be an absolute unacceptable outcome that we make any cuts. And in fact, in the spirit of the legislation we have before you, we ought to be making additional investments into a community that desperately needs adequate access to healthcare.
Great. Alrighty. Well, seeing no further questions from the press. Any other questions?
Yeah, sorry. I guess I had a quick follow-up
Yes,
there.
of course.
So just to make sure I'm understanding the basics here, this legislation, if it's approved, would create new physician training centers, expand existing ones, and then subsidize tuitions basically for those who enroll in them?
Well, the tuition issues that are being discussed, clearly, you've heard the stories, and we all have, of residents who graduate and begin their practice in whatever area of that they've specialized in, and have enormous bills to pay off their medical education that's in six figures and higher, and so clearly that's an issue that I think has to be addressed as a part of this, and I'm glad you pointed that out in terms of the impacts of the tuition and how we train our physicians in this country. But I think the whole reimbursement model, frankly, we need to take a fresh look at. It's not working, and we see many hospitals in this country that are in financial deficits that really, as Representative Gray indicated, have impacted our healthcare facilities here in the Valley, and there's examples of that. And so this is something that to use a medical term, we can't continue to triage the status of our healthcare facilities and our healthcare systems and the financial support that keeps that healthcare available on a 24/7 basis. Every American deserves the right to a effective healthcare for themselves and for their families. And clearly that's why this shortage of physicians is, a critical issue. And that's why we're trying our best to move this legislation forward. But I think everybody on this effort believes that there are other important goals that we have to achieve to improve America's healthcare system for all its citizens, regardless of where you live.
And sorry, just last question, I promise, to connect these dots. Is there data to suggest that a lack of physician training centers is the reason behind physician shortages in the Valley? Like, are current physician training programs impacted at institutions in our region?
Yes, and there's an anecdotal, I think, bit of information that my colleagues here might want to add because they have their own personal experience. But my understanding is about half the students that have completed the residency program, this existing partnership that both doctors have referenced over the last 20-some years, have ended up staying to practice here in the Valley. And while that may be anecdotal, I think the reality is this: if you're from Southern California, you're from the Bay Area, you're from out of state, you come and you practice in an area like the residency program that we have presently, although not a full-fledged medical school, you meet people, you develop associations with folks. You find out that maybe you wouldn't normally pick Fresno or Merced or Visalia or other communities, small towns, to necessarily practice, but you live in those areas, you develop friendships, and physician students are just like everybody else. They train and then they meet people, they fall in love, they develop roots in that area, and they stay in practice. So I think having a medical school in an underserved area is going to result in expanding the amount of physicians that you develop locally. And I think Dr. Margot Werner, in her own statement, explained what a large amount of interest in the student body that she's experiencing, in part for those reasons.
I appreciate your asking this question, thinking about it, because it's so central to what we do, right? And if you look at the data the data suggests that two factors really strongly influence where physicians stay to practice. One of them is where they're from, which of course is why we're recruiting students from the Valley for the Valley, just to be doctors for their community. And the other factor is where you went to residency. Those are the two biggest drivers. And the picture of how do we train physicians is a complicated one, and how do we get them to stay? Partly because, as you can imagine, if we start training a physician today, it's going to be many, many, many years before they're there to take care of you and your family. So how do we get the physicians that we need to come? How do we think of the entire trajectory, not just like what we're planning for years out, but how do we get them to come sooner, and importantly, to stay? So part of the stimulus of developing a med school or medical training effort is that physicians love being where they're trainees. Doctors like to talk, they like to teach, they like to influence the next generation. So when we think about how the whole picture works together, we think about the push and the pull factors. Retaining physicians for an underserved community is not as simple as just saying we're going to recruit locally and then hope that we can get them to all just stay where they are, and nobody moves, nobody falls in love, nobody moves out of state. It's obviously more than that. We do need to do that because their family and their communities, their ties are there. But we also need to think about really enriching medical schools, residency training programs, fellowship opportunities, so that those are all things that draw people into the Valley who maybe came from elsewhere. And those are exactly the things that when they see a strong, thriving community makes people want to stay. So we want to recruit residents from outside areas also to come. They will love the Valley. It's a great place to work. And when you're a trainee, when you're a resident or fellowship, part of what makes you decide where you want to stay is, do I see a great community here with good colleagues and emphasis on high quality of life, good practice community, great passion and enthusiasm for the mission of health in the Valley? And that's exactly what you see. And that's what residency programs and medical schools and fellowship programs bring. They really enrich opportunities to teach and be part of a vibrant community. That's part of what makes people not just stay, but also move from outside and then really become a contributor. And that's what's going to get us more healthcare for our patients and our communities.
Excellent. I think Tim Sheehan had another question. We have time for that. Tim?
Yeah, thank you, Jim. Dr. Vernier just mentioned it, and Dr. Bond had also referenced the time that it takes to go from, an undergrad student to going through med school, going through residency, going through training as in some sort of specialty. And I wanted to kind of get a ballpark timeline of the number of years that we're talking about to go from undergrad to practicing.
And
I'm super glad that you asked that question, because I think it's really important to understand why we need to invest now for our future, because it takes so darn long, right? To be a typical baccalaureate student in college, to get your Bachelor of Arts or Bachelor of Science is typically a 4-year degree. And this is all assuming that you go straight through from medical school from baccalaureate to medical school. Some students, need to actually do some extra work or delay graduation to help support themselves and their family. So this is the most optimistic prediction. So 4 years of getting your baccalaureate degree, followed by another 4 years of medical school, followed by a minimum of 3 years for residency, but more typically 3 or 4 or 5 or more. And then often people will do a fellowship to become, for example, a cardiologist or a gastroenterologist or something like that. So it's when you start adding up the years, that's a lot of years together, which is why it really gets back to this idea of the push and the pull factors. It's not, if you start investing in just one student now, it's going to take such a long time before they really are there to take care of you at that moment when you need them to be your gastroenterologist, your cardiologist, your emergency physician, or dare I say your family doctor. It's going to take a long time. So when we think of it, that's why we have to think about the whole trajectory, because it's like, how do we draw people in to come and stay and be part of that vibrant community starting now, and not just sort of investing and then like the time clock is ticking and we don't have enough time for the future. We need those doctors now. And that's why this effort's important, because this is what will both inspire people to stay, but also inspire people to really come and embrace the communities and serve them. So thank you for asking.
Thank you for answering.
Great. Seeing no further questions here on the chat, we thank you all for joining. Congressman Costa, would you like to say anything before we conclude here?
Yes, and if my colleague Representative Gray also would like to say a few words. This is every journey begins with a first step. I had conversations with Senator Kaine about his circumstance and situation in the state of Virginia, and he was attempting to address physician shortages, and we thought, let's try to put together legislation that we could end up getting broader support throughout the country. And so this journey has begun with the introduction of this legislation, and we hope that we'll be able to complete it in this Congress over the next 18 months or so, 2 years. We'll keep you informed, members of the press, and I would also suggest that those of you in the San Joaquin Valley area take times to meet with Dr. Bond or Dr. Werner or my friend at Community Medical Center, Dr. Utek, and really see what's going on where the rubber meets the road, and where their challenges are, and how this could really enhance our ability to take the time to create the educational opportunity, be it 10, 12 years on the timeline that Dr. Werner indicated, so that we can trade it. There are also economic factors as well. I mean, cost of living in the Valley and other rural parts of America are less. Physicians don't make what physicians used to once make out of medical school. So there are a whole lot of factors to building new medical schools in the instance of the San Joaquin Valley, are expanding existing ones. So all in all, I think we have our work cut out for us, but we've got a good team here, and I think that we're going to continue to pursue this for the future healthcare of Americans throughout our country.
Yeah, and I'll just close by thanking the congressman for his partnership in solving this important problem. I think too often in today's political climate, we seem to have lost sight of the fact that government should serve to actually improve our lives and our communities and make things better. And the situation in the San Joaquin Valley is not that we spend too much money on healthcare, or that healthcare, the service is too good and the physicians are too available. And in fact, very much the opposite. And so this is part of an effort to continue the dialogue that we've had in building a medical school program in partnership between Fresno and Merced and the San Joaquin Valley, UCSF, UC Merced, Community Hospital, and others. And just really happy that we can come together and push this important legislation forward, and look forward to bringing more money to improve our healthcare infrastructure and make people's lives better in the San Joaquin Valley. Thank you.
Thank you all for joining. We hope you have a good day.